Hey, what's going on, guys? My name is Abhinav. I'm a first year medical student working to get an MD PhD degree. And today I wanted to react to Dr. Mike's new video about TikTokers and medical advice. And Dr. Mike, if you don't know, is one of the greatest medical doctors on YouTube. If you haven't checked him out yet, he's a really funny guy. Please do subscribe to him. I'll keep his channel information down in the description. I wanted to react to this video that he released recently because I feel like there's some stuff that I could add to this. And please remember that I'm a medical student. I'm an idiot. Please don't think that I know more than Dr. Mike, because I probably, and actually most definitely, do not. So with that being said, I thought I could give a little bit of insight into things that he's talking about and things that I just want to add on to his description of things that he's seeing on TikTok. So with that being said, let's pull up his videos. Before I do that, please remember to like and subscribe. It helps me out a lot. And let me know in the comments if you want me to react to anything else and to review anything that I'm learning in med school. I do a lot of videos based on how to get into med school, as well as different medical topics about things that I learn about. So without any further ado, let's hop right into it.
There's a ton of terrible medical advice online, but some of the worst has been on TikTok. And by worst, I don't always mean just inaccurate. I mean flat out dangerous.
Honestly, that's really true. There's so much bad information on the internet, and I see patients come into the hospital all the time saying that they look something up on the internet, and we just think about it as like medical students and doctors, like, oh no, what did they read? They're probably thinking of the worst case scenario. But it's actually really important to acknowledge the things that people read online, especially if it comes through trendy places, and assure them that sometimes the things that they're experiencing just happen to be coincidental symptoms that do align with certain diseases. But we do have algorithms that are in place to make sure you're not diagnosed with the wrong diseases.
Butter, ragu.
Don't go together?
Get that thing
Oh,
in
that's
now.
disgusting. Oh,
Dip it,
no,
dip it.
please, no.
Oh. Not only is that really not tasty, the saturated fat inside there, that's terrible. The arteries are screaming, I feel it.
Now this combo smack. I gotta try that.
Smack what?
Eating butter like that is not good for you. That will just raise your cholesterol levels very high or very fast. And honestly, that's probably not good for you.
How to stop your period for an emergency.
What?
2 shots of squeezed lime juice, Tajin powder,
What is Tajin powder?
salt for flavor,
Guys, I had to come back to give you an update because holy guacamole, it worked.
No. If it doesn't have hormones in it, I don't understand how it could possibly work. The menstrual cycle does experience regularities naturally, like if you travel, if you're around other individuals. I don't think it's due to this like little tequila shot or whatever it was that she took.
And that is incredibly true. Pregnancies and menstruation cycle, it's all regulated by hormones. And honestly, if you think about it, and if you read the description of contraceptives and Plan B and all that, those are literally hormone pills. If you're on any birth control, those are hormone pills that are kind of making your menstrual cycle and all your hormones in the body all whacked up and in a place where you're not able to keep an endometrial lining. Or if you do get pregnant, the baby and the fetus cannot implant, or it'll just get lost. So if that drink had some sort of hormones and you take that consistently, hey, maybe it works. But based on what that TikTok said, yeah, that's not gonna work.
5 organs, 5 exercises to help you restore those organ functions.
Please be medically
I love
accurate.
his hand gestures.
Please.
Heart, you're gonna pound the inside. These are the nerves that are connected to your heart.
These are the nerves that are connected to your heart. This is the skin, this is the muscle, and there are nerves here that are not connected to your heart. Why?
I mean, technically, there is something called referred pain. If you do get like a heart attack, there are feelings that you get that travel down your arm into your pinky. That's a sign that you're having a heart attack. And I mean, those nerves are technically going to the spinal cord and kind of interweaving into the nerves. But the way that this doctor is portraying it, Yeah, that's just not how it works. I mean, there is more and more research going into referred pain and looking at the neurons that are connecting. And I mean, you could have an argument that every neuron is connected in some way. Eventually, it'll reach the brain, and there's so many connections there. But things like acupuncture and like tapping your arm like this, yeah, that's just not gonna work.
What are we even talking about right now?
Slap your arm, slap it.
Slap it. Slap it. You know what's a good exercise for your heart? Jogging.
I love Dr. Mike. He just makes everything so much funnier.
Lungs, open up the chest, lungs.
So he's saying to breathe. Okay. As ridiculous as that one looks,
Breathe.
I'll still give him a pass on that.
You're gonna do the cha-cha for your digestive system. This is for your spleen, your stomach.
The spleen is not a digestive organ.
Exactly.
You're gonna do the thrust.
If you don't know, the spleen processes red blood cells and makes sure that they're healthy and gets rid of any red blood cells that are not healthy. Also in some immune responses. I mean, there is a connection to everything in the body, but the way that he's portraying it, yeah, that's not how it works.
Thrust for your kidneys, thrust for your kidneys.
What? Just
And
drink
that
enough water, stay
kidneys
well
don't do
hydrated, sleep
anything
well, get
with
some
that
exercise, and eat some plants and vegetables. You don't need to thrust.
Drinking sparkling water isn't considered water.
What?
Definition of water is fish must swim in it.
Okay, this is a Saturday Night
This
Live
is really
sketch.
ridiculous.
Sparkling water is not high sodium, but it has a deep mineral content.
The depth of its mineral content makes it not water.
So best bet is always water first. Definition of water is fish must swim in it.
Water first is
You know, the tap water that you have has minerals in it. It has things that are dissolved in it. And I probably would assume this guy would say that that's water. And the thing about fish swimming in water, fish swim in both fresh water and salt water, and both of them can be dangerous. You don't want to drink like water that's out in the world without knowing, or without boiling it at least, making sure that there's no contaminants in it.
a fine mantra, but fish must swim in it is ridiculous because fish swim in salt water. And if you drink salt water, oh boy, you're gonna be in for some troubles.
You put garlic up your nose, it's supposed to cleanse your sinuses.
No, they don't cleanse your sinuses because they're garlic.
So far, there's a little bit of snot trailing out around the nostril holes.
So, if you're sick,
I mean, this has been shown that garlic does contain some enzymes in it that causes like that burning sensation, and maybe those like vapors are going up into your nose and causing your capillaries to dilate, and that causes some snot to like, you know, get runny and get out. I mean, if this is constantly working for this person, I mean, I don't see any particular harm unless like garlic clove might get stuck up in your nose, which is not a good thing. But other than that, I mean, why do it? I mean, just get like one of those kits, like some saline that you get sprayed up in your nose, and that should pretty much clear it out.
you have snot, and that's what's happening
I feel a lot of congestion right up in here.
because you plugged your nose with the garlic.
There's just snot building. Oh, that's nasty.
Yeah, that's all the
Okay.
snot that would have come
jeez.
out had she not put those in there. It's an irritant
I mean,
to your
I
nasal
feel
passageways.
like
You don't
the
need to do that.
garlic
If you want to
would
clear your
promote
snot
it,
out,
but-
use nasal saline. This is a complete myth. It just does not.
All the top athletes are not drinking this stuff
What?
because I found out that Gatorade is actually very, very acidic.
You have lemon flavored Gator.
You know what's also acidic? Your stomach acid, where this liquid is going down. And I wouldn't say that all Gatorade is acidic. And if you think about it, soda is acidic, carbonated water is mildly acidic. If you just put some lemon juice in some water, there you go, acidic. Your stomach is acidic by nature, and you have mechanisms in place to make sure that acidity goes away once it reaches your digestive tract. And honestly, I think Gatorade's a great product. It has electrolytes. If you get the sugar version, it has a lot of energy in it, and there's probably also caffeinated versions. I mean, Gatorade's a great product if you don't have enough electrolytes or you're dehydrated. I mean, I'm all for Gatorade. Not sponsored, by the way.
This right here actually promotes inflammation, promotes aging, and it promotes injury because once the body goes acidic, it cannot heal.
The body keeps a very tight range of its pH, very tight, 7.35 to 7.45. If it starts gently coming out of that range and becoming more acidic, even slightly, it could be lethal. So drinking Gatorade does not make your body go acidic, because if it drops your pH to below 7, every time you have a Gatorade, you would be dead. That's why health gurus really frustrate me and confuse the life out of me. Because on one hand, they tell you to take antioxidants like vitamin C because they say they're so good for you. On the other hand, they tell you to avoid acid of any kind because it's so dangerous. So you know what vitamin C is? It's ascorbic acid.
He's just dropped some knowledge on everyone. Yep, vitamin C is ascorbic acid, and it is an acid. It's in the name. And yeah, the blood pH levels are tightly regulated in the body. You really don't want them to go outside. Dr. Mike here is completely correct, and he made it in a great way. Things like alkali water that people drink, if anything, that's just gonna neutralize your stomach acid and probably make even more stomach acid to compensate. And like these drinks don't really end up in the blood like that, where it causes huge fluctuations. If they do, you probably have a bigger problem.
Do you have a stuffy, congested toddler? I'm gonna show you how to clear them out. Blow out of one side of their nostril. Make sure their mouth is shut.
Oh, geez.
Hold her mouth, blow.
Moms are so
nasty.
creative.
Ooh.
Cute video, not the method I would recommend. Use a suction tool like a bulb. Pushing it out sometimes carries risk, removing bacteria around the airway. The child can choke on the snot. Plus, remember, your mouth has a bunch of bacteria in it that you're putting into your child's mouth. So suction is always better in this scenario than blowing air in. This technique does work sometimes, breathing in a child's mouth. If your child has something stuck in their nostril, closing the other nostril, breathing into the child's mouth. For me, if something's stuck in your child's nose, go to the ER. Like, that's the safest way to get it out.
I would be more concerned here about blowing the eardrum, because blowing into the nasal cavity like that, there's a tube called the eustachian tube, or the auditory tube, that connects the the nasal cavity to your ear, into your middle ear, and blowing into that might cause pressure into the ear and cause damage to the eardrum. I would be more concerned about that. And also, like, a baby's like just delicate in terms of their cavities like that. And obviously, as Dr. Mike said about the bacterial infection, that's a higher risk. But I feel like that's just a dangerous technique. I mean, unless you like really account for the pressure and it's like very tuned to your baby's passageways, I mean, I wouldn't really recommend that. Again, I'm not a doctor, I'm a medical student, so, you know.
Imbalanced hormones. Hey, my name is Dr.
He's
James
lost
Cedar,
it.
and you're probably thinking to yourself, what does a big burly linebacker looking guy like me?
My man, have you seen a linebacker?
Women looking to lose weight, especially in their midsection, may want to pay more attention to foods and activities that balance hormones based on their unique hormone type.
And he's gonna sell you exactly what their unique hormone type can benefit from.
This really aggravates me, of people trying to advertise like weight loss things and vitamins on social media. It's just like, no, that's not how it works. I mean, yeah, there can be some home remedies here and there that are effective, but people are, at the end of the day, trying to sell you stuff. And if you buy their product, you're a victim to their marketing. And yeah, I just don't like these people.
My unique hormone type quiz, because a hormone type 2 needs a different approach.
A hormone type 2 that I just made up.
Than a hormone type 6.
It's like where you're placed in Hogwarts will determine what your hormones are and how much belly fat you'll lose. Oh, he's completely lost it.
6. What happened to 1, 3, 4, and 5, and 7?
Well, obviously they don't have it.
As a doctor to come up with my own hormone types. You definitely want to sanitize the area before you do any kind of microneedling. That's smart. If you're going to be making abrasions in your skin, so much can go wrong, especially on the face. I just wouldn't trust a random device bought off the internet.
Kind of felt like.
Yeah, we actually just learned about this in anatomy. This area of the face right here is referred to as the triangle of death. The reason is because there's something called emissary veins. Basically, blood in this area has a connection to the internal veins of your brain through the ophthalmic veins. And what happens is if you, let's say, pop a pimple or you have a cut on your face and that leads to an infection, that infection can possibly go into your brain, and blood over there moves a bit slower than other places, and that means that it can accumulate there, the infection, and that can cause lots of problems in the brain. Obviously, that's like the worst case scenario. You're probably fine, but like I still wouldn't risk it having multiple cuts onto your face using this microneedling.
Like getting a tattoo, had only a couple spots that bled just a teeny tiny bit.
Places for infection.
People really trust these things. Being a family medicine doctor, not a plastic surgeon or a dermatologist, when a patient comes in with even a small laceration that requires sutures on the face, I'm always hesitant to do it because I want to make sure that it's as less scarring as possible happening, so I let someone with a lot more experience do it. These people are just like doing microneedling on themselves with no fear.
There's lines on your face, imaginary lines, and basically all over your skin, that where you cut for like surgeries or something, like they cut in a specific spot for a C-section, so that scarring is like healed to a minimum because your fibers, your extracellular matrices are laid out in a specific way. So dermatologists are very good at knowing that and figuring out where to cut, if there is a cut, or how to stitch things up so that there's minimal scarring.
Life-saving advice from movies that can actually kill you. According to Hollywood, if someone is passed out with no pulse, you should straddle them, give them mouth to mouth, and beat on their chest.
Yeah, don't beat on people's chest. Don't give them mouth to mouth if someone's passed out. All you have to do is chest compressions, chest compressions, chest compressions.
There was actually a revision recently about mouth to mouth is not necessarily required, but chest compressions are very much needed. And you know Dr. Mike, he loves his chest compressions. And yeah.
I'm not saying CPR doesn't work, but it only works like 2 to 4% of the time, and when properly performed, you usually end up cracking the person's ribcage.
Yeah, he is right about that. CPR is not that effective. But if you do put that into a large sample of people, if it works about like 10% of the time, that's still a lot of people that you save. So it's better to do it than to not. And yeah, cracking ribs is definitely a concern. If you're doing it properly, you probably will crack some ribs. But honestly, like, your bigger worry is trying to circulate that blood into the body so that any oxygen that is there is able to be circulated and get to like important tissues like the brain. That's really the major point of CPR. Just buying time until you can shock the heart or get them to a hospital.
My man is confused here because he's saying pounding on their chest versus performing chest compressions is both CPR. Factually untrue. The purpose of performing CPR is not to bring someone back, it's to buy time so other interventions can be done. Like giving them medications like epinephrine or perhaps bringing a defibrillator along. Because the reason you're pumping on someone's chest is to circulate the blood that's already in their body that has some oxygen still left in it. And the breaking of the ribs, no big deal. Why? Because the person is already dead. So if you can extend their possibility of being brought back to life by breaking a rib, fair trade-off, wouldn't you say?
So yeah, that was reacting to Dr. Mike's video about TikTok medical advice. It was a very fun video. I love Dr. Mike. He's a very great, funny guy and makes medicine pretty fun to learn about. He goes through a lot of different things in his channel. Please do check him out. If you don't, you probably already do, and you're coming here to look at a reaction like this to Dr. Mike. But in any case, thank you for watching. Please let me know if you'd like me to continue doing reactions to YouTubers, medical YouTubers, and other science topics. It's really fun. With that being said, please do like and subscribe. It helps me out a lot. And with that, I'll see you next time. Bye.